Hello, my name is Mallory, and I will be doing my presentation on von Willebrand's disease. So von Willebrand's disease is a lifelong bleeding disorder in which your blood doesn't clot properly. So people with the disease have low levels of the von Willebrand factor, which is a protein that helps the blood clot, or a protein that doesn't perform as it's supposed to. Also, most people with the disease are born with it, having it inherited from one or both parents. However, warning signs such as heavy bleeding or heavy bleeding after a dental procedure might not show up for years. But von Willebrand's disease cannot be cured, but the treatment and self-care for most people with this disease can lead to active lives. The etiology of von Willebrand's is that it's inherited from an abnormal gene that controls the von Willebrand factor, which is a protein that plays a key role in blood clotting. When you have low levels of this protein, small blood clots called platelets cannot stick together like they are supposed to, or they can't attach themselves to the blood vessel walls when there's like an injury that happens. Which causes uncontrolled bleeding. People with von Willebrand's disease also have low levels of the factor 8, which is another protein that helps with clotting. Rarely with von Willebrand's disease can develop later in life in people who didn't inherit the affected gene from any of their parents. This is known as acquired von Willebrand syndrome and is likely caused by underlying medical conditions. There's genetics. So this says, what I found on the CDC website was that it's an autosomal dominant. Von Willebrand's is caused by changes in only one copy of the gene related to the disorder. In autosomal dominant inheritance, a child will inherit the bleeding disorder if he or she gets the von Willebrand allele from the gene that has a genetic change causing von Willebrand's from one parent who has a disorder. So some of the demographics is it occurs with equal frequency among men and women. It's affecting about 1% of the general population. It did state that women are most likely to experience symptoms of von Willebrand because of the increased bleeding during menstruation or during pregnancy or after childbirth. Patients diagnosed with von Willebrand's were prominently white with a blood group of O and a family history of von Willebrand or other bleeding disorders. So some of the symptoms are excessive bleeding, either from an injury or after a surgery or dental work or from childbirth. Nosebleeds that are longer than 10 minutes, pain and swelling or tightness in the joints, blood in the urine or stool, bleeding that stops and starts up again, easy bruising and lumpy bruises or cuts that bleed for more than 5 minutes. And so diagnosis is the doctor will likely recommend different blood tests, and there's many. So one of them is called the von Willebrand factor antigen, and that determines the level of the von Willebrand factor in your blood by measuring a particular protein. There's also the von Willebrand factor activity, which is a variety of tests measuring how well the von Willebrand factor works in your clotting process. There's factor 8 clotting activity that shows whether you have if you have abnormally low levels and low levels of activity, or the factor 8. And then there's also one called the von Willebrand factor multimers, which evaluates the structure of the von Willebrand factor in your blood, its protein complexes, and how its molecules break down. This information helps identify the type of von Willebrand disease that you have. So the results of these tests can fluctuate in the same person over time due to factors such as stress, exercise, infection, pregnancy, or medications. So you might need to repeat some of the tests. If you have von Willebrand disease, your doctor might suggest that family members undergo testing to determine if it runs in your family. There's different type of maintenance forms. There is, let's see. There's desmopressin, which is a medication available via injection. It's also a synthetic hormone that controls bleeding by stimulating your body to release more of the von Willebrand factor stored in the lining of your blood vessels. There's replacement therapies, which include infusions or infusions of concentrated blood clotting factors containing the von Willebrand factor and the factor 8. There's also, for women, there's oral contraceptions. In addition to preventing pregnancy, these drugs can help control heavy bleeding during menstrual periods. The estrogen hormone in the birth control pill can help boost the von Willebrand factor and the factor 8 activity, which is something that we do often at my job, especially for patients that have issues with like abnormal bleeding or that isn't related to either like fibroids or issues with the uterus. There's also clot stabilizing medications, such as Amicar, which is aminocaproic acid. There's one called tranexamic acid that we use also at work. I think the generic name is called Listetta. That can help the bleeding by slowing down the breakdown of the blood clots. But they're only used for like limited times, I believe. And then there's also the drugs that you can apply to cuts to help with the healing. It's usually like a glue and a syringe. And there's like a lot of over-the-counter stuff too. And then there was a study that I seen on the CDC that I wasn't able to put in one of the slides. So I think that there was a study of 102 women with all different types of the von Willebrand factor. And it says that the most commonly reported bleeding symptoms among the women were heavy menstrual periods, which was 95% of them. And then bleeding after minor injuries, which was 92% of them. And then excessive gum bleeding, which was on 76% of the women that were tested. It looks like 74% of the women reported bleeding from several different places, like their nose, the gums, and also like from the uterus. After following several procedures like dental work or surgery, childbirth, or like minor injuries. And then 41% of women reported that diagnosis of migraine headaches. Also 30% of women with von Willebrand reported diagnosis of arthritis. 37% of women reported controls that their menstrual period and limited routine work, social activities had a negative effect on their life. And then there was one where they studied 42 men and 38 women with the type 1 von Willebrands, which is the most common form. It looks like most of them had like bleeding symptoms that were heavy, like amongst the women, so heavy menstrual period on 93% of them, and then nosebleeds on 53% of men. So 45% of the women and 50% of the men were reporting excessive bruising. 40% of women and 47% of men reported excessive bleeding with surgery. 34% of women and the 29% of men reported bleeding with dental work or like washing their teeth and stuff. And then 21% of women and 20% of men received blood transfusions. And then the last one says that 76% of the men with the von Willebrands were diagnosed by the age of 10. And 50% of the women with von Willebrands were not diagnosed until after the age of 12. And yeah, that concludes my presentation. Thank you.